Gonna record. Welcome again to another Zoom call, and let's jump right into the questions. Just another reminder, please send your questions via the member site. We cannot answer any emailed questions. The law has changed since COVID, and they're just really the American Medical Association and all the medical boards are just clamping down on one-on-one visits with practitioners that aren't licensed in that particular state. Now, I could go over labs because I'm not really giving any medical advice that's not really a medical visit, but I can't answer questions. So we got to keep it to an educational Zoom call like this. It's crazy, and it is the law. Dr. McCullough had a big thing that came out today, how the American Medical Association and the FDA and everybody is trying to shut down his site. Google has already, shadow banned him. So unless you go directly to his site, it's really hard to get to him. Joe Tippin's site has been completely shadow banned by Google. If you know his website, you can actually go to his website to learn more about the Joe Tippins protocol, but you search fenbendazole and Joe Tippins on Google and you just won't find anything anymore. The FDA has made us take all our fenbendazole and Joe Tippins information off of our site and off of the store. This is the reality of what's going on in the alternative perspective. And in the realm of our world, we're getting attacked literally on a weekly basis by the pharmaceutical industry, like I've never seen throughout all my years of practice. They are using this pandemic to literally try to destroy anybody that's not doing pharmaceutical and following the pharmaceutical protocols. So just so you know, not that I'm whining, but this is why we have to do these Zoom calls. The Zoom calls are educational. It's still free speech, at least for the time being. So being able to educate in a group like this is still free speech. So ask all the questions you need to ask in these Zoom calls. I do, please, just to help me save my voice, please do glean through past Zoom calls if you have time. You might be able to download them on your phone and you could just listen to them like a podcast. We're trying to figure out ways to better have access to things like that as well, so that to give you access to that. But because, and I get, you're new to our clinic, you don't have time to listen to 500 Zoom calls. Give me a break. I get that. I really do. But please just try to look at some of the things on the member site and some of the things on our website when you're asking questions, because the questions might already be answered. And that just saves you time. So, all right. Members as our full members, our quote unquote patients, you have full access to all my courses. And I'm going to have an autoimmune course and a mushroom course soon. So you have access to all of these. Use the same username and same password as you do to get on the member site. You can jump on those courses if you really want to nerd out on some stuff. Certainly, you can learn more about your genetics. We have some genetics questions in today's Zoom call. Go to the Read Your Genes course right here, and you can learn all about your genetics and more than you really would ever care to know. So, and then the frequency healing course has a lot of information, more information about the Rife too. All right, questions. What is the difference between tumor cells and cancer cells? Is there a difference? We've touched on this on many, many Zoom calls. There really is no difference. It's old terminology. What's a tumor? What's a cancerous tumor? What's just cancer? How's there a difference? It's hard when there's been decades and decades and decades of medicine and terminology used in the practice of medicine. And updated terminology is used, but then the old terminology is used everywhere. It's interchangeable. So, or is a tumor benign, or is it malignant? Well, it depends on what adjective you put in front of it. So when you say cancer, then you always know that's a malignant disease. If you say tumor, then you have to know what adjective you put in front of it. Is it a malignant tumor? Or is it a benign tumor? It's semantics. People who say stay away from animal protein, can they use collagen? Maybe, maybe not. So we test for that if we think a person should be able to use collagen or not. If you're a hardcore vegan, then you're not taking collagen. But if you're only staying away from animal protein because you have cancer and animal protein can feed the cancer, then typically not. You could use collagen. But if you're staying away from animal protein for some, you know, moral, ethical reason, then you would probably stay away from collagen as well. But with cancer, no, you're probably safe with collagen. Can heat used with a castor oil pack cause constipation? No, I don't think so. No, I mean, anything could cause anything, I guess, but pretty much probably not. Can castor oil pack be used on lumpy breasts? I don't know if you're just talking about fibrocystic breast disease using a castor oil pack. I don't know. When you put castor oil on your skin, you will absorb some of it. I don't think I would do castor oil packs on fibrocystic breast. No, I wouldn't do that. I certainly wouldn't do it over a breast tumor as well. DIM metabolize, I think this means will DIM metabolize good estrogens or just bad estrogens? It can metabolize both. I don't think it's specific just to the 4-hydroxyestrogens. I think it can help get rid of all estrogens, which isn't a bad thing, because other estrogens are precursor to the 4-hydroxyestrogens. So I think it will reduce all of them. Now, again, not anything like, taking a medical drug, aromatase inhibitor, but it certainly will reduce the total estrogen level. I found a local physician willing to provide IV vitamin C infusions. We will begin after I can provide them with a dosing and frequency. Can you throw out suggestions so I can get started? Well, the physician who's giving you the IV infusions should be making the suggestion. I will make you a suggestion, but they're the ones that they should be the dosing doctors. I will tell you that most clinics that you go to for IV vitamin C want to get you up to high doses very quickly. I think it's best to titrate, meaning that you start at a lower dose and you go up. Now, what dose do you start at? Something like 20 grams. And then over the course of a month, maybe you're getting up to 60, 80 grams. That is also depends on how many times a week you're doing it. If you're just doing it once a week, it might take you 2 months to get up to 80 grams or 75 grams. A lot of clinics jump on 50 grams right away and get you up to 100 grams. It can have some side effects too. So I don't know that personally I would do that. I would start at 20 grams, do that multiple times and move up to 30 grams. It also depends on the bags that their supplier that they're getting them from and what gram increment that they can raise that at. So, but I always think it's better to start slower and move up. Can you please explain what some of this means? Okay, this person sent in information on their RGCC test. So does everybody know what the RGCC test is? So the RGCC test, they have multiple different things that you can run with RGCC. It's also known as the Greek test. That tests different specific genetic markers that would be specific to different tumors. And it can be billed as a cancer test that can predict cancer in a person. So if I think I have cancer, but I don't know, so I can run the RGCC test and run this particular test with RGCC, which this person ran, and they might get some inkling whether they have cancer or not. Now, I certainly hope that the doctor that ordered, I don't order the RGCC test. We don't do the RGCC test. I hope the doctor that ordered this test didn't tell you, or if you have ever done it, that you've never had a doctor tell you that we'll do this RGCC test and this will tell you if you have cancer or not. Because the only thing that can tell you if you have cancer or not from a medical legal standpoint is a biopsy. Nothing else can tell you from a medical legal standpoint. It can give you clues, but it can't tell you specifically, you have pancreatic cancer, you have liver cancer, you have this cancer. Now, certainly scans, like a CT scan, especially, a PET scan even more so, and a MRI, a radiologist who's a good radiologist who's looked at 50,000 slides can look at it and go, that's cancer. But then they even write in the report that says, this is suggestive of an astrocytoma, or this is suggestive of colorectal adenocarcinoma. But they can't legally say that it is, because the only way that you can say that it is cancer is through a biopsy. Now, a radiologist has looked at these scans a million times and they know it's adenocarcinoma, but they can't legally say that. That's why you see that type of verbiage on a CT scan. But they say it's suggestive of, it's, they give you that type of protective terminology so that they're suggesting that this is a progression of the cancer, or this is a metastasis to the bone, but without a biopsy, I can't be for sure. So with the RGCC test, it's the same thing. They can say this is suggestive of this type of cancer, but they can't say that it's cancer, nor can they be specific that it is the exact cancer that you're looking for. This rest of this question, I think, was a comment from the doctor who ran the test. It said this test was supposed to tell me, or this part is for the patient. This test was supposed to tell me the exact tissue the cancer is coming from. So if you thought that and you were told that by the ordering doctor, that was incorrect. Maybe they didn't say that, and maybe that's what you heard. Maybe they did say that, and that was misinformation. Can you help me understand this? For example, what is TTN morbid, and what does likely pathogenic mean? I don't interpret the RGCC test. So if you guys go do the RGCC test through another practitioner, you need to have that other practitioner interpret it for you, because that's not my specialty. I don't run that test. I haven't done intensive study on that test, and I don't plan to, because that's not my specialty. So you have to have them interpret that. TTN morbid, I don't know what that means. That's a terminology specifically from RGCC, but likely pathogenic, this term right here. So when they say this is likely pathogenic, that is another one of those terms that, like a radiologist would say, this is suggestive of, likely pathogenic means this is probably cancer, but I can't say that because legally you'd have to do a biopsy to say that. So unfortunately, I've had multiple people come to me and say, I did the RGCC test because the practitioner said that's what's going to diagnose the cancer. And I have said, okay, you got to understand that does not diagnose cancer. Legally, the only diagnosis of cancer that you could get is through a biopsy. So I hope practitioners that run these tests aren't giving misinformation, because they're not inexpensive test to run. And if they're leaving people with the same doubt that they had before they had the test, then I question the value. This is the same thing I say, with every test that you do, you have to weigh it out between, okay, is this going to give me information that's going to help me change the way I treat my body? And if the answer is no, because I'm going to keep treating the same way, then why do the test? If the answer is yeah, then do the test. What makes me a little sad is that if a practitioner told you that it was going to give you information, that it fell short of that, I feel bad for the person who ran that test. So I apologize that I can't give you any more information on that. And if you do call the office and say, I want Dr. Cutters to go over my RGCC test, Maureen or whoever answers is going to say, no, he doesn't do that, because I don't do that. I don't want to do something that I don't feel qualified to give you that information, and it's not going to help you. I want to stay within my lane in my knowledge center, and which is pretty limited. I know, but that's not something I specialize in. I don't want to botch up a report. So kind of ties into this question. What's your opinion on SOT therapy? Well, I don't know a lot about SOT therapy, but same thing that you could read about it, because it's not something I do. We've had multiple members do it, but they were doing a whole bunch of other stuff. So, the one that I talked to, this was about a year and a half ago, they said, oh, they thought it helped, but there was no objective data that it helped. So, even they said that, so I think there's validity in all of these different types of therapies. But yeah, I just don't know enough about it to say, yeah, I think it's great or I don't think it's great. I know there's the other member went to a place down in Florida that did it, but I know there's places in Mexico that do it too. I just did a parasite test kit. My lymphatic system seems to get backed up when detoxing, just doing my normal protocol for cancer. What is your thoughts on doing a parasite cleanse if they determine I have them? I feel like I don't feel good more than I feel good, especially with swollen lymph in my neck and sore throat. So should we talk about parasites? It gets a little tricky because most functional medicine doctors, and certainly all regular medical doctors, if they see a parasite test, they think, oh my gosh, we got to kill it. There's parasites. Oh my God, that's horrible. We got to kill those parasites. But there's a whole other line of thinking. So yes, excess parasites in your body can cause issues where your immune system is fighting a battle at multiple fields. And in one sense, it does make sense to kill parasites. But in another sense, you have to understand that even parasites can have a symbiotic relationship in your body, meaning that they aren't necessarily doing damage all the time. And if you're going to try to do a big parasite cleanse and flush using things like wormwood and olive leaf extract and different herbal things like that, well, those are good and that can be great. You have to look at, am I healthy enough to do that? Is it going to be pro or con to me? The best thing to do, honestly, I know this isn't a great, yes or no answer, but the best thing to do is you can try things. So there are some parasite protocols with biocidin and CellCore products that you could use to, you could even pulse them. Instead of doing I'm going to do this 21-day parasite cleanse, you could go, I'm going to do, maybe every other day with this, or I'm going to do every third day with this, and see if it makes you worse. Now, let me take a step back. Many people with cancer, you're solely focused on the cancer, but we ignore sometimes the possibility and the real likeliness that we also have comorbidities. meaning we also have other things going on. And the most common thing that we have going on and that we see throughout society is a comorbidity of an autoimmune disease. You have an autoimmune secondary, maybe even primary to the cancer condition going on. You have antibodies to self-tissue. That's why my autoimmune course, I really want, once I get it done, everybody, all my cancer members to go through it, because you're going to find that there's a lot of ties that tie in with cancer and autoimmune disorders. So what is an autoimmune disorder? It's when you have antibodies to self-tissue, any self-tissue that you have antibodies to. And then there's different levels of autoimmune disorders. It could be in a latent level where it's not really causing symptoms to a tissue destructive level where you see damage to bone, or you have damage to the tissue itself. And then the middle level is where you have the symptoms, but not huge amounts of tissue destruction. A lot of people are in that second level where you have symptoms of that. And many times we are blaming cancer for some of the symptoms that we may be experiencing that are really autoimmune related. And the reason why I'm talking about it with the question about parasites is that when you have an autoimmune issue and you're going to go after killing a parasite, that can flare an autoimmune issue. So typically trying to kill a parasite with some of the nutritional things that I talked about a couple of minutes ago, if you solely have cancer, there's really no harm, no foul. It's not going to hurt your cancer by using some of those parasite killing, parasite cleansing nutrients, or even a parasite killing medication. It can actually help kill the cancer. In the case of like ivermectin and fenbendazole and things like that. But if you have an autoimmune disease comorbidity, then you could actually flare that and become worse. That's why I said, even if your parasite test comes back positive, I would still maybe go slow with the treatment, because if you have a comorbid autoimmune disorder, you could get worse. Matter of fact, some autoimmune patients do better when they have a parasite, which is a total flip-flop of understanding. There is actually a treatment for autoimmune disease that's called Helseth treatment, where you actually get a bottle of these parasite eggs and you take that once a week. Yeah, crazy, huh? So you're actually inoculating yourself with parasites, and in doing so, it causes an immune reaction in the gut, and it takes the immune reaction away from the autoimmune site. Let's say if it's thyroid, or if it's lupus or MS, and it's really has helped a lot of MS patients. So not to get too off on that subject, but you got to keep in balance that just because I have this doesn't mean I have to kill it. There could be negatives to it as well. Hopefully I didn't take too long to answer that question. On Monday, there's a question about swollen lymph nodes. I have breast cancer and the nodes under my arm are very sore. Is DMSO something to use to bring relief, or is there something else that could help? Like I said, DMSO, disulfimethoxide, is a sulfur component. You could buy DMSO. It's liquid. It's like water. You just use a little bit on a cotton swab, and it's highly anti-inflammatory. Now, it's a sulfur component, so you'll taste garlic in your mouth after putting it on your skin. But it was very common in the 70s and 80s to use it on your like a swollen knee or a sore ankle or rheumatoid arthritis, any type of joint arthritis. And it kind of fell out of sorts because the FDA went after it all and said it was a hoax and all this kind of stuff. But it is an anti-inflammatory. You can't argue with it. But it is also readily absorbed through the skin and it can be a driver. So if you have lotion on your skin that's toxic and you put DMSO on it, it'll drive the toxic lotion right into your body. You shouldn't be putting toxic lotion on your skin is the lesson. But so you got to be careful with it. If you have dirt on your skin, or if you have, gasoline on your skin and you put DMSO on, you're literally driving the gasoline and its petroleum toxins right into your bloodstream. So you have to be careful what you use it over. But if you have clean skin, using a clean organic cotton swab in the bottle of DMSO and putting it right on it, test it, see how it works. It can be a great anti-inflammatory. You can also use it to drive other things. So you could get a liquid zinc, put that on the skin, and then put DMSO over it just like that. If you're putting a, that's why some of the bloodroot pastes have DMSO in it, because it will drive the bloodroot in through the skin. So you can use it as a driver of other things too. I have had lots of body aches, possibly long COVID, and have been on prednisone. Is there something else I can use? I had been using the Clear Inflam, but that just wasn't enough. Make sure you're running the COVID programs on the Rife machine. So I do have a video on the website about long COVID as well. I'll try to tomorrow, I'll try to remember to put it up on the member site. Might be better on the member site so the FDA doesn't come after me about that video too. And that will help too. Nothing is going to decrease inflammation as fast as prednisone, I'll tell you that. The other thing that you can use that has helped a lot of people is a product called Limitless. Limitless is a Betalin. It's a patented Betalin product, which is the most highly anti-inflammatory substance that you can get without a prescription. It's called Limitless. It comes in a box of 20 or 30 of them or something like that. We have it on the store, Limitless. That might help as well. We've seen people that were on, I haven't personally seen anybody on prednisone, but I've seen people on taking 20 Tylenol a day go on Limitless and get off of their Advil or Tylenol. After retesting a cheek swab in August, you changed a few supplements. One of my new ones is Clear Dim. The first time I started it, I only took it for a week. I had nausea, hot flashes, and genital yeast issues. It's interesting. We've had, maybe it's the same person making these comments, I don't know, but multiple comments of people using DIM and getting these type of symptoms. What are these type of symptoms of? They're symptoms of dropping estrogen levels. So nausea, hot flashes, genital yeast issues, urinary tract infection type things. That is a symptom of lowered estrogen. That's the goal of DIM. So you're purposely taking it to lower your estrogen levels. So you could back off on your doses to help with that issue. You could pulse it to help with that issue. But in reality, that's really what we're trying to accomplish with it. I recently started it again a week or two ago, and I'm not having the hot flashes or nausea, but I'm having reflux and yeast issues again. I would suggest the reflux has nothing to do with it. The yeast, yes, it probably has to do with it, as well as joint pains in my hip and fingers. Yes, that could have to do with lowered estrogen levels. So I would just pulse it, even if you take it every other day. If you take it, for 3 days, off for 3 days, that's called pulsing a supplement, something like that that you feel comfortable with. Should I continue the Clear? Yep, so I would continue to do that. One more question related to hormones. One of my cancer causes was hormones. According to the testing, I was taking bioidentical progesterone before my diagnosis, but have not since March of last year. Would you recommend Progessence essential oil? That's a Young Living oil. or progesterone cream? Or is it best to stay away from these with my breast cancer history? I would not recommend those things. I would highly recommend you stay away from those things. Well, why? I have an estrogen positive cancer, not progesterone positive cancer, because excess progesterone. So you're taking this cream, you're taking Progessence, which has estrogen in it too. That's a topical essential oil as well. You're getting progesterone absorbed through the skin. It absorbs very readily. You're increasing the progesterone in your body. That's what I would recommend if I want to increase somebody's progesterone, which I used to use that a lot for different patients. Now, since we only really see cancer patients, we use that less, because if you have an estrogen, progesterone, or HER2 positive cancer, or even if you don't have that, you will increase your estrogen. Oh no, this is progesterone, not estrogen. Excess progesterone is going to be stored in your fat cells. So excess hormones, progesterone, testosterone, and estrogen get stored in your fat cells. And then you have an enzyme called aromatase that breaks down that hormone in your fat cells to the bad estrogens, which you don't want to do. So you should not, this is where women should not take testosterone either if they have a hormone-driven cancer, because excess testosterone will be stored in the fat cells and aromatase will break it down into bad estrogen. Hence the term an aromatase inhibitor. An aromatase inhibitor blocks the breakdown of any hormones into bad estrogens and helps eliminate all estrogens from your body. That's what an aromatase inhibitor does. It's blocking that whole pathway. So that is a normal pathway in your body. Excess progesterone will be stored in fat cells and aromatize into bad estrogens, and you don't want that to happen. So no, you don't take that. I was listening to a podcast and he mentioned that high DHEA was a risk factor for breast cancer. Why would that be? Because DHEA is a hormone and DHEA is a precursor to testosterone and progesterone. So that's why it is a risk factor for breast cancer when it's elevated. That's why I don't recommend people take DHEA. So it's very common. That's a supplement. You can get that, anywhere. And it's very common to take DHEA and have doctors recommend DHEA, especially when people have adrenal fatigue. So, oh, you have adrenal fatigue, just take DHEA. That will really help. Well, it really will. But it's a precursor to progesterone and testosterone, which then is a precursor for hydroxyesterone, which can increase your risk for breast cancer. I had a Dutch test almost 2 years ago, and they noted in my report that my DHEA was within range, but higher than expected for my age. Is there anything I should cross-reference in my genetics results on that issue, or any other results in the Dutch test that could give me more clues about what caused or fuels my cancer? Nothing in the genetics will show the correlation with DHEA. Doing another Dutch test can be beneficial. So it depends. You did the Dutch test 2 years ago. You should probably do it again. You can order it in our store. So we send you the kit, you do it at home, you send it in, and we talk about the results. Doing another Dutch test would be the thing to do. And we do the Dutch, I think it's called the Dutch Complete, which also gives you a whole adrenal profile and measures your DHEA too. So when we get additional supplements recommended with our genetic report, are those correlated with the previous cheek swab recommendations? So I was given PON1 Assist and AI after the genetics. No, that's totally based upon your genetics. And okay, so let's finish the question. Because I remember you saying that just because you have a problem with the gene doesn't mean it's affecting the cancer. Like I have a couple other variants that can elevate homocysteine and blood pressure, but I have neither symptom. I'm just trying to prioritize expenses. I'm assuming that the first recommendations aren't enough to cover what seems to be relevant genetic information, but I don't know how to tell which ones are affecting my cancer the most. So I would agree, if if finances are an issue and you want to drop supplements, I'd drop the genetic ones first. The PON1 Assist, or what we have private labeled as phase 2, is really supporting your phase 2 pathways. That is really, I tell you, talk about correlative, and I don't know cause and effect, but the PON1 pathway with breast cancer is just like amazing. There's actually a lot of research that's coming out about PON1 defects with breast cancer. It's just correlative, but it's not necessarily causative, but it's a huge correlation. So I would drop the AI. I would keep the PON1 Assist if you can. The description to the side for the AI supplement seems off. Was it reformulated? No, it wasn't. It doesn't describe the pteramids. The pteramid is the bentonite clay, and says it has glycine, which I could use for one of my gene variants, but the label ingredients does not have glycine in it. I'll have to look at that. The AI is actually a supplement that I personally formulated for PHP. So I'll have to pull up the supplement and see. Can't remember, that was a few years ago when I formulated it. From the chat, just getting up and running and didn't get a question in early or have the opportunity to search prior Q&A. Sorry, that's okay. I noticed some of the programs I wish to run on the right say they need a bulb, like the hammer bulb, other than the hammer bulb. Okay, so just ignore that. So you have a hammer bulb. Is the QX2 bulb a better bulb? No. Is the QX2 bulb stronger if you put it right up to your skin? Yes. Is the QX2 bulb for the purpose of putting it right up next to your skin? No. The QX2 bulb is for putting it on a stand to use during the day so you can walk around the house and it will go out a little bit farther and you'll get a little bit more benefit. Do you need the QX2 bulb? No. Do I even recommend the QX2 bulb? Almost never. Now they have the hammer, the jackhammer, if you want to use it during the day and you want to walk around, but still it's only going to really go out 8 to 10 feet. So do I suggest you even get that? No. If you call True Rife, are they going to try to sell you on these things? Probably. So personally, I only use the hammer bulb. So just that's what I would suggest. Unless you're going to like do some of the facial programs and you want to get that zinger bulb, that is a bulb you're putting like some different nutrients on your skin and you're using the bulb on your, if you're doing a specific purpose like that, then yeah, you could get that zinger bulb. But other than that, I wouldn't use anything but the hammer bulb personally. That's, and you could ignore, just because they have a different bulb in the picture doesn't mean anything. And just because they have it in the write-up, it just, that's what they were using when it was written up. So don't worry about that. Seems like taking honey and pure maple syrup has done well for me. Should I not use stevia as well? Or are they not even closely related? So honey, maple syrup, and stevia are typically used to sweeten food. They're all natural, but two of them are going to increase glucose levels. Honey and maple syrup, stevia will not increase glucose levels. So if I was on a pure ketogenic diet, I could not take honey and maple syrup. I would use stevia as a sweetener. But if so if you're trying to keep your glucose levels down, you try to use more stevia. Is there benefits to honey? Yes, there's other possible benefits to honey. Is there benefits to maple syrup? Yeah, not really, but it is a sweetener, and both honey and maple syrup do I think they're kind of in the middle of the range of how fast they break down to glucose. Stevia won't elevate your glucose. So sorry, not taking honey or maple syrup. Okay. Well, certainly stevia is going to be safer for not, increasing your glucose levels. Can the Rife program be installed on a Mac laptop? Yes, but it's a different program. It's a program for Mac. We got a second Rife and was going to put on my laptop for convenience when the HP is upstairs. You can put it on your Mac. You have to download that from TrueRife, and they do have download for Mac. So it looks different. You're going to have to get used to it. Personally, I have it on my Mac. I don't use it on my Mac. I don't like the way it looks. It's just odd for me because I've used it for 15 years on a PC. And I don't use a PC for anything but the Rife. I only use Mac for computer stuff. So. Is PON1 Assist very different from allergic acid? No, it's not. So if you're already taking allergic acid, you really don't need PON1 Assist. So allergic acid actually has, if you're taking the Allergicaps, ALLAGICAPS from Best on Earth products, if that's what you're taking. Okay, yes. Then you don't need the PON1 Assist, because that has enough pomegranate in it. I have a bottle right here. I actually take that too. That's a good product. So you don't need the PON1 Assist. Good question. Pomegranate is so good for us. If you like to eat some, don't talk about that a lot because, it's not that commonly used. I mean, we think of berries and raspberries, because we grow raspberries and blueberries and strawberries. You readily think of pomegranates. But pomegranates, boy, I remember when I did coursework for functional cardiology, that taking, I think it was literally like a quarter cup of pomegranates a day lowered a person's blood pressure as well as 20 milligrams of lisinopril. That's crazy. So it's really good for your heart. Pomegranate is one of the best things for your heart and your blood pressure. And it's really good for your phase 2 pathway in your liver. It's really good for detoxification. Pomegranates are great. Now, it does have glucose and it will raise your glucose levels, but it's one of those really good fruits. So getting pomegranates and blending those into your smoothie would be another great thing instead of just using blackberries, blueberries, and raspberries. So great nutrients, all these great nutrients that God gave us, natural ways. All right, I think we will call it a night. Thank you guys for being on again tonight. Know that I'll be praying for all of you. I love all of you guys, and I'm up praying for you guys. Not kidding, every single night. I ask that you keep praying for our protection and our health as well. And get your questions in on the member site, and I'll see you on Monday. Bye-bye.